everyone. Welcome back to another episode on the Medical Pulse podcast. I'm your host, Anish Mohan, and with me on today's episode is Dr. Dhiraj Pangal. Doctor, thank you so much for taking the time to join this episode, and I'm excited to get started.
Awesome. Yeah, thanks so much for having me, Anish.
So first, for me and the audience, why don't you just tell us a little bit about yourself and what you do in the medical field?
Sure. My name is Dhiraj Pangal. I am a physician. I am a current resident in neurologic surgery at Stanford University. And so I specialize I'm a physician and a surgeon, and the conditions that my patients have are surgical conditions of the brain and of the spine.
Okay, so neurosurgery, I think most of us know that that is one of, if not the hardest specialty in medicine. So for you, do you feel as if neurosurgery was something that you knew was for you early on in undergrad or medical school, or was that something leaning into residency you decided was something that you wanted to do?
It was always something that I had an interest in. I studied the neurosciences as an undergrad. That was my major. And so connections of the brain and how the brain works, both from like a chemical standpoint and an anatomical standpoint, were always very interesting to me. Um, I I knew I kind of wanted to be some type of a surgeon, or at least I thought I did, but it's very difficult to know until you've kind of gone through and lived the life a little. So I had an inclination, like long story short, I had a feeling I wanted to be a surgeon. And of being a surgeon, I had a feeling I wanted to do neurosurgery, but it wasn't until kind of the middle of medical school that you work with neurosurgeons and you work on neurosurgical services. You see patients who need neurosurgery and you see the surgeries and you participate in them. And that is really kind of what makes you go, okay, I can do this, or I want to try to do this.
Okay, that's cool. So now that you are a neurosurgeon, what would you say is your favorite part of neurosurgery or something that you really like constantly doing as a neurosurgeon?
Well, I think, neurosurgery, you deal with patients who have everything from, back pain, leg pain, all the way to traumatic injuries of the brain, um, brain tumors, aneurysms. So I think the breadth of what you do is pretty wide. I will say it's pretty narrow in the grand scheme of things, but at least it feels wide. And then, for the most part, you never really go a day without feeling like that, you wake up early and you stay late for neurosurgery, especially as a resident, but you never really you never really have any question that your services are needed or that you can help someone today.
Yeah. So would you say that for you, neurosurgery was something that now that you are a neurosurgeon, do you love what you do? And is it something that you wake up every day feeling like, oh, I'm excited to get to do this? Let's go help people and save lives.
Well, I think I'm in the middle of my residency, and so I think if you ask most people once they're finished with the residency, I think the answer is yes. Residency's hard. Residency's 7 years long, and there are plenty of days that you wake up and it's a challenge. But at the end of the day, you know that what you can do is, as you go through the years of residency, the skills that you pick up and the knowledge that you accrue and the things you can do with your hands and with your judgment and with the team that's around you, you start to feel the uniqueness of it. And so, I think as you get more senior in your training, and then especially as you start your own practice, or you start your own practice, I think that feeling of hey, this is a very special thing that you're able to do, that grows. So even now, yeah, I mean, I think you when those moments, and you deal with a lot of sick people in neurosurgery, and so the times we're able to help someone, those are definite wins, and you feel that as a win for sure.
Okay. So as a resident, I think I personally know that residents obviously worked, in my opinion, work the hardest as doctors in the hospital. What does a typical day look like for you as a resident? And over like when it includes like surgeries, cases, the amount of sleep you usually get? What does it look like?
Yeah, so it kind of ebbs and flows. I'd say residency for surgeons can be kind of split into two phases for the most part. I mean, every program is slightly different, but for the most part, you have your kind of junior residency days where, usually you're at the hospital anywhere between 4:30 and 5 in the morning, and you need to essentially get all the updates of the patients. And then as surgeons, we round very early. We round and see all our patients kind of usually before 7 a.m. And you do that with a larger team. And then as a junior resident, you spend most of your day, you know, definitely seeing patients, taking care of patients, but less of it is spent in the operating room. A lot of it's more, how do you take care of a neurosurgery patient? How do you know that a neurosurgery patient needs help? How do you interpret the imaging that a patient gets? And so, then you're usually home by 6 or 7, and you oftentimes have to, depending on how your system is set up, there's plenty of nights that you're on call. And so sometimes that involves starting a shift at 6 p.m. and finishing at 8 a.m. the next day. Sometimes it involves starting at 6 a.m. and then finishing at 8 a.m. the next day. So you're working like a 26-hour shift. Um, so that's a lot of your junior residency. And then as you become more senior, you transition into more of an operative role.
Yeah.
And so you're doing anywhere from on the low end, like 6 cases a week, on the busy end, like 20 cases a week.
Okay.
Um, some of the cases are an hour long, other ones can last like 12 or more hours.
Okay.
Sometimes those, if there are days that you finish quickly and it's like a nice kind of light day and you're home by,
Mhm.
you start your day at 7 o'clock and 6 o'clock and you finish by 3 or 4. And then other days cases are long or you have emergencies that come in or you're called in the middle of the night to do surgery and, you're there, kind of all day, all night. It's just kind of as you get more senior, you are there for as long as you need to be in order to operate on the patients that need your help.
Well, okay. And would you say that that is the hardest part of residency, like the unpredictability, or like how unpredictable residency is, or what would you say is the hardest part of residency, whether it's as a like junior residency or even now?
I mean, I'm in kind of in the middle of my residency, like I'm literally halfway through my third year of residency, and so, I'm transitioning more towards the senior residency side of things, but I'm still very, I can still very much see the junior residency part of things. I think part of it is just the stress and the demands of the job are very high, and the kind of margin for error is very, very slim. And so, kind of with everything that you do, it has to be done in an exacting way. You have to think through every decision. You have to think through every, if you're in the OR, every step that you make, it can go wrong. And if it goes wrong near important structures in the brain or in the spine, that's a problem. And so that kind of mental load, I think, starts to really wear you down. And then on top of that, yeah, the physical nature, like surgery is not, there is definitely a mental component to it, but it's very physical.
Mhm.
Like, there are oftentimes you're just operating in very strange angles for 10 plus hours a day, or, you're straining your body for hours and hours at a time. And so that is demanding. And then, yeah, you're just working a lot. So when you work a lot, it's tiring.
Okay.
But so those are, I think, the hardest parts of residency. But that's because, we as society have 7 years to train someone to go from not being able to be a neurosurgeon or not knowing how to do neurosurgery to being able to take care of any neurosurgical patient in the country. And so there's a lot to learn in those 7 years.
Okay. So as someone who's currently working to become a licensed neurosurgeon in the middle of residency, what would you say is the like specific traits or habits that aspiring neurosurgeons or even surgeons in general should be looking to develop throughout undergraduate and medical school? Are there certain characteristics or skills that you believe are necessary for the job?
Yeah, for sure. That's a good question. There's like a pretty well-known quote that the most important things are to be um, able to be affable and to be available. And I think those are pretty true. Like you have to be competent, you have to be able to do things. And so if you're, like the really good residents and the really good surgeons know that we have a task to do, and those tasks most of the time don't come with instruction manuals. And so you have to know the constraints in which you have around you, and you have to know what's safe and unsafe and just be able to get it done. There's like a pretty famous like parable called A Letter to Garcia, where it's like an old World War II story. I don't think it's even true, but the story is a general goes to this um, this super high performing private and says, "Hey, you need to get this message to Garcia," and hands him a message and says, "If you don't, people are going to die." And that's the instructions that the guy gets. And he's got to go figure out who's this Garcia person? How do I get there? How do I get to him safely? And that's kind of the attitude that, you know, for better or for worse, is kind of permeated within neurosurgery or within most surgery, I would say. So you got to be able, and then you got to be affable. Like nobody wants to work with a guy who's like, you know, not nice
Yeah.
and doesn't like isn't a team player, guy
Yeah.
or girl that isn't a team player, or someone who, doesn't bring a good kind of energy to the team, especially when you're doing hard things. And then third is to be available. Like, if you're, you got to be dependable, you got to be reliable. If you're going to say you're going to do something, you gotta follow through with it. And so those are the traits more so than intelligence or, people always talk about like your hands. Like I think most people who, can get into medical school have the intelligence to be a neurosurgeon, and most people who get into medical school probably have the hands as well. Those can all be taught, like the knowledge can be taught and the hands can be taught, but those kind of innate characteristics, those need development when you're much younger.
Okay. Okay. So, so another question for you is, as let's say students who are aspiring to be again neurosurgeons or even surgeons, or let's just say even doctors in medicine, what kind of advice would you give to students who are preparing for this, especially high school students? Is there anything certain that helped you or you wish you knew earlier in your career?
Yeah, I mean, from a super practical standpoint, I think there's kind of a big barrier. Like once you're in med school, you can kind of do, the barrier to become a neurosurgeon or a plastic surgeon or an orthopedic surgeon or whatever is much lower because you're in a small group of pool of people. It's very self-selective. Like there aren't that many people who want to be neurosurgeons. There were like three of us in my class in med school, and nobody else wanted to be a neurosurgeon because of, there are many reasons. And 10 people wanted to be orthopedic surgeons. Nobody else wanted to be an orthopedic surgeon. And so it's, that is much easier. It's easier that when you're there, but getting into med school is the big barrier, and that's super competitive. It's only getting more competitive, I think. And so the things you can do are like get straight A's in high school, get straight A's in college, and crush your SAT and crush your MCAT. Like everything else, yeah, you'll have to do it, but odds are if you're doing those other two things, then you'll figure out the like extracurriculars and like all this other stuff to what that you have to do. But you know, I don't the formula is kind of unfortunately very simple. It's like it's difficult, but I'm not saying I did like the most spectacular job of it either, but that is kind of the formula, and that would be the advice. That would be what I would tell myself is like, dude, don't worry about all these other things. Like, just crush your grades and crush your standardized tests, and like make that your modus operandi, and then everything else you'll figure out.
Okay. Okay. So I actually wanted to shift a little bit to something that I think is more relevant than ever. It's AI and technology. Do you feel right now, as a neurosurgeon, do you feel like AI and technology is becoming a bigger and bigger part of medicine and healthcare? And can you see it in day-to-day activity?
So yeah, for sure. I mean, I do a lot of work in this space. I have for a number of years. We built some of the early dictation tooling for like, to be able to write your notes and stuff. We've built a nonprofit that does artificial intelligence based analysis of surgical video to quantify surgical actions. And so this is a world that I'm super pro towards. I'm long in it. I'm long AI in medicine. Right now, where are the uses currently? It's a lot of back end functions and a lot of administrative tasks, which don't get me wrong, are very, very useful. It's a lot of the bloat that we have in medicine that are non-clinical functions, but that require high levels of execution. And so artificial intelligence is good as that billing, coding, writing notes, but it's starting to bleed in. There are radiology companies that are doing automatic stroke detection and hemorrhage detection on CT scans. Like Viz AI is a popular one. There are lots of companies looking at analyzing data using artificial intelligence, or like Open Evidence is a good example of a really big company that is essentially providing like a clinically reasoned chat GPT where you can ask relevant medical questions. Um, and institutions are like, for instance, at Stanford, we have like a secure version of chat GPT that people are using. We, in fact, are rolling out a chat GPT that's embedded within our electronic medical record. So you can chat within a patient's chart, and kind of pull data a little more efficiently. Um, but again, those are kind of fringe tasks. I think people are still developing the the things that will be total game changers within the clinical realm that 10x a physician's productivity. So you can treat 10 times as many patients because your incision's tiny, or your plan is super precise. People haven't really built that out yet. So a lot of the things that I think influence the like real bottlenecks in medicine, or the things that like really can fundamentally change the game, haven't come to fruition yet. But I mean, I think that's just a time function. I'm pretty bullish on it all.
Okay, okay. And do you feel that do you sometimes feel like, well, for me, I watch medical TVs and shows, and I've seen a lot of these there's like robots in the OR, or like the humans are using robots to do the surgeries. Is that something you're seeing now?
So that we do have surgical robots. It's mostly used by general surgeons and urologists and OBGYNs. The most popular one is called the Da Vinci. It's by a company called Intuitive.
Mhm.
And it's a phenomenal system. It's essentially a console that the surgeon sits in, and it's like VR goggles, and you put your hands in like these little, like they like wrap around your fingers, and you can actually have do bimanual and dexterous movements. Now, if you talk to a bunch of, again, that's not my field, so I'm not gonna, I can't really claim one way or another. But if you talk to a lot of, gynecologists and urologists and general surgeons, a lot of them will question whether or not that's really much better than doing it, how we would do it before, which is laparoscopically, just with the same number of incisions, essentially. But the surgeon is holding the instruments at the end of essentially sticks, instead of having these robotic ports go in. I will say that though, that the ability for robotics to kind of take the next step is probably going to be one of those like 10x improvements,
Okay.
being able to do things autonomously or robotically and remotely, I think will be like a huge, a game changer for us, being able to treat patients anywhere in the world. Is going to be massive. But in neurosurgery specifically, we have a couple of robots that are right now used in the spine. But again, they're not completely autonomous, but what it can do is essentially if we're placing screws in the spine,
Hmm.
it can take a CT scan that we get in the OR and using three-dimensional space, plan out exactly where the essentially docking mechanism needs to be. So all you have to do is you put the instrument through it, and there's like one trajectory that you put your screw through, and it's perfect. And then you move on, you hit next, and you move on to the next one. We have a similar kind of system for putting electrodes in the brain. And so again, it's all use imaging and you plan out your trajectories and then you reference, that's all done on a computer, but you need to then transfer it into real life three-dimensional space. And so you provide some sort of a reference for the robot, and then the reference puts that, or the robot puts that reference onto the images and then can kind of directly target where you need to be putting your electrodes. So that's what we have right now. In some instances, it's helpful. Like for the cranial electrodes, it's super helpful.
Okay.
But it doesn't make a 10 hours, it doesn't make a 6 hour surgery 30 minutes.
Okay.
Um, it does make it more minimally invasive, definitely. But there's still plenty of, it's still entirely humanly executed, right? Like a human can't
Yeah.
not scrub in or anything like that.
Yeah. Okay, that's interesting. Yeah, it's something I always find interesting, especially watching like medical shows. I see
Yeah.
like robots fully automating surgery, and that's something. Oh, is that really what's happening in hospitals? Okay. Anyway, I just have last question for you. Throughout this whole journey, pre-med 4 years undergraduate, medical school 7 years residency, in your opinion, what has been the one thing that has really kept you going throughout all these years of schooling? And based on that, what advice would you give to aspiring students who are looking to go down these long residency pathways?
That's a good question. I think for me, it's always been the people that have been around me. It's never felt like really, if your only goal in this is the end result, I mean, you're going to be miserable for your entire, like, for all your 20s and most of your 30s.
Okay.
And so you have to enjoy the process. You have to enjoy the people you study with as an undergrad. You have to enjoy the people you start, organizations and clubs with as an undergrad. You have to enjoy the people you study with as a med student. I met my wife in med school. And the mentors that you find are going to be like, the one thing I haven't said and I absolutely need to is my like two biggest mentors that I found actually while I was an undergrad. One of them I found when I was like a first or second year undergrad, and they were both neurosurgeons. And one of them, Gabby Zada, is like to this day, is like if I need advice, I go to him, and he's not even one of my attendings here. Um, and he was instrumental in guiding me through the process. And what I initially thought was that a mentor is someone who you like, they like, I didn't think this was the reality, but it felt that way, that they like sign a letter that says, I am your mentor and you are my mentee.
Okay.
But that's completely not true. And it's just a relationship that builds over time, like any other relationship. And so find people who can be mentors early. And it's often very difficult as a undergrad or as a high school, or even more so, to find people that are willing to give you the time of day. And it's oftentimes a numbers game, and you just have to like ask a lot of people. And
Mhm.
one of those many people will say sure to a first meeting. And then, you ask for a second one, and ask if they need help with anything. And you slowly start to build a relationship that way. And those people are really what guide you through it and who give you advice when you're like, man, I don't know if I can do this, or if I should do this, or I don't know if this is what's right for me, or all these people are telling me XYZ and I don't know what to do. And they'll help guide you through it. So it's really all the people.
Okay, yeah. I mean, that's really good advice, especially as high school students not knowing where to start. And if you don't know a lot of people that are in the medical field, in people that you know, it might be hard to get a clean perspective on what am I about to be in for, or what is a career that I want to do really like. Yeah, I think that'll help a lot of people. Anyway, that's all the questions I had. Doctor, thank you so much for being on this episode of the Medical Pulse podcast. It's really, really interesting to hear from doctors of a variety of specialties, especially neurosurgery, one of the hardest specialties in medicine. So I want to thank you once again for joining the show, and I'm sure the information will be very important and impactful for many students.
Yeah, thanks so much for having me. This is a great kind of initiative, and I think it would have been nice to be able to have something like this when I was a high schooler, kind of exploring the options, the many, many options of what I could be doing with life. So kudos to you, and keep it up.
Thank you. Thank you. Hope to see you soon. Goodbye.
Take care.